And welcome back to Health View. Again, this is Dr. Angela Ruff, and our guest this morning is Dr. Yvette Stokes, who is a pediatric dentist and owner of Highland Pediatric Dental. And if you have questions for her later, you can reach the doctor at firstsmilesYMS@AOL, and their office number is 910-485-8749. Now, Dr. Stokes, during the break, we were talking a little bit about sedation dentistry for children. And, back in the day, they didn't offer any sedation for kids, correct, much less adults. And so it's like, hang on, and we're going to get it done.
And actually, no local anesthesia.
Yeah. Like the teeth you're not supposed to feel it.
Like the children are not supposed to feel anything.
Yeah, what's up with that?
Well, thank God we changed our ways.
Yeah,
we have changed our ways. And absolutely, a child will feel pain just like an adult, as we discussed earlier. And there are different modes to treating a child. Some children you can treat just with local anesthesia, as you might treat an adult. Some children need a little bit more help, as some adults do. You want to sedate that child. There are mild sedations where you're just giving something to, we always say, kind of take the edge off, something to just relax you a little bit. And then some children will need something to sedate them a little bit more, something maybe like Valium, that's going to actually make you a little more tired, just a little bit more sedated. And then some children need something that's going to give them a much better sedation, which usually are the younger children, and we do some sedations with some drugs, a couple of different drugs to give a more profound sedation, but it's always a conscious sedation.
Right. Now, sometimes you use the hospital.
Sometimes we use the hospital, general anesthesia, when sedation in the office is not the best thing, usually because of age. Most of our sedated patients can tolerate procedures in the office. Sometimes they cannot, and sometimes because of the amount of work that you do. We do comprehensive care in our office, and sometimes we can see children that every tooth in their mouth is decayed. Those children might be 3 years old, 4 years old, and it's usually those younger children that we take to the hospital under general anesthesia and fix all the teeth at one time.
Right. So obviously it's very safe. You have an anesthesiologist there.
All we do is the dentistry. The hospital handles everything else just as they would if you were going in for any other type of surgery. So there's an anesthesiologist and a nurse anesthetist. They handle all of that, and the kids tolerate that very, very well. It's an excellent.
Well, they go to sleep and they wake up and it's done.
And it's done. Yeah, and it's all done.
Right.
Absolutely excellent mode of treatment.
Right, and so you don't necessarily create a dental phobic that way.
True.
So, just an aside question: how would somebody's dental insurance handle that with an anesthesiologist and all this other?
Actually, that is a bit of a problem because some insurances will handle the hospital anesthesiologist and the hospital. It's a short day. It's a one-day surgery. You're in and out the same day. Right. Some insurances will cover that, and some will not. There's legislation where insurances are required to pay for general anesthesia for dental services, but some insurance companies can have little loopholes depending on how you get your insurance and what type of group you're with. Some of them have little holes, and it will not cover it.
Right.
So it is, if you have insurance that will cover that, that's a tremendous privilege.
Right. And y'all probably do pre-estimates for parents.
We do pre-estimates, exactly. The hospital actually will do a pre-estimate for the medical coverage because it's your medical insurance that might cover that, not your dental.
Okay.
That part of the hospital.
Okay. Yes. Well, that's good to know. Now, I'm sure everybody's read in the news lately where there's some, one was a pediatric dentist, but most of these dentists that I've read about that have kind of got trouble with sedating kids, they did not have that special training in the pediatric field, and then didn't necessarily have the special training with sedation for kids.
Yes.
Because we were talking earlier during the break, I have a special sedation permit, but it's for adults.
Right.
Adults.
They
behave very differently, so I respect that. And so if I have any kids that need sedation, I refer them to you. I was like, we need to see Dr. Yvette here.
And I respect that. I think, you are very excellent at what you do, and I do the same thing. When I have a teenager that has more than what I consider I should be handling as a pediatric dentist, I do the same thing. I say, this is general dentistry, and I refer it to you.
Yeah.
Same thing.
Anyway, so that helps, because I have parents that are patients of mine, and they're wonderful, but boy, their kids really, I think, need the aid of a pediatric dentist. They're just not maybe quite at the age where they can be cooperative for me to be able to handle it. And if I can't if I don't feel comfortable, I don't have the special certification to sedate kids, I don't feel comfortable with that, I haven't gone to the extra training for the sedation for children, then, I want this kid to not become a phobic.
Right.
And if the kid's uncomfortable and unhappy and I can't sedate them, I feel like that's what I'm doing. I'm creating a dental phobic if I end up treating them. It's not fair to them to not give them the opportunity to have a trained pediatric dentist help them and they be happy about it, And
it's not fair to ask you to do that.
Yeah.
It's if you're uncomfortable, not quite sure, that's just not what you want to do every day.
Right. And it doesn't mean their kid's a bad kid.
Exactly. They're not. They're behaving like a 3-year-old or a 4-year-old. But when you're in your element, and I know that because I've been in your dental chair before, my husband's been in your dental chair before, when you're in your element, you're wonderful. You're comfortable. You're very secure at what you're doing. And that's what we should do every day. If we're just, this is not quite what I want to do, I really would rather not be working on this patient, then that's just not what we should do.
Right. Let's get them to somebody who feels qualified with keeping them comfortable and happy. Do you mind just kind of going over? We're talking a little bit at the break. I'm thinking, man, we should be recording this. But about what could have kept some of these docs out of trouble when they were doing this sedation. What do you guys do differently that maybe if these other people could have done that could have avoided the whole bad scene?
Well, typically when you hear about an adverse incident, when you hear about a death of a child in a dental office, we always say we bet that was not a pediatric dentist because of just what you said. We have special training. Now, there are always instances where there might be a pediatric dentist who's not doing the things that they should be doing to take care of those patients, and that has happened also. But as you said, a child is not a little adult. You have to be very, very conscious of how you're treating that child, the drugs that you're putting in their bodies. And when I say drugs, the sedations, even the local anesthesia is a very potent drug. And very oftentimes when it all boils down to it and we get all the information, kids are often overdosed on local anesthesia or the drugs is the main causes of death. So if you're cognizant of the age, the weight of your child, very crucial in determining how much work you can do at one time. You can't do a full mouth at one time because they cannot tolerate that much anesthesia. You have to limit what you're doing based on their weight. When you decide to sedate, that is always based on their weight or based on what their normal weight would be if they're an obese child. You have to consider that also. You can't just always give the maximum
just because they're
amount.
Overweight or an adult weight doesn't mean they're an adult.
Does not mean you can always, depending on which drugs you're using, does not always mean you want to give that child that much drug. So on an everyday basis, we're always checking ourselves. Every time I give local anesthesia, I look at a child as I'm giving local anesthesia, and in my mind I'm thinking, she weighs 30 pounds or 40 pounds or whatever. I know I can't use but X amount of anesthesia.
Right.
And if
so that may limit how much you can get done.
It limits how much you can get done, and you just don't fudge on that. If a parent wants a little more work done, they only want one visit. It's just not a matter of
healthy choice.
It's not a healthy choice, and it's not something to negotiate. It's just absolutely not. When you're giving drugs, those are based on weight. When we sedate children, we get a weight almost every time they come in the office. Okay, what is your weight today before we're giving those drugs? When we do conscious sedations, we weigh that child that morning, and then we say, how much do you weigh? This is how much medicine you get. That child also has to have a physical to make sure they don't have any airway problems that would interfere with sedating them, because when we sedate them, they're very, very drowsy, very, very groggy. They are capable of maintaining their airway because we only do conscious sedation in our office. So we want to make sure that is a healthy child, first of all. You need to know who you're sedating. Are you sedating a healthy child? And you just can't feel pressured. You can't feel pressured to get this perfect patient in the chair. A 2-year-old will behave like a 2-year-old. A 3-year-old will behave like a 3-year-old. That needs to be okay. And I always tell my parents, they're going to behave like a 3-year-old, and that has to be okay with you because it's okay with me, because I want the parent to be comfortable when they cry a little bit, when they fuss a little bit, when we have to hold hands. That is normal for that child. It's not abnormal. It's not bad behavior. It's normal. And we have to be comfortable with that. If you're comfortable with that, then and you will be comfortable with how you have to treat that patient.
Right. And just, remaining calm, I think.
Absolutely. Absolutely. And then you're always trying to talk that patient into behaving better. You're always trying to say, well, it's okay. It was just a little pinch. You're always talking to that child because we do some things that are uncomfortable.
Right.
This is not a perfect science. They're going to feel some things that you do, but you kind of have to talk with that patient and form a rapport with that patient. And as you're doing that, we can give local anesthesia and the child is crying. And then as soon as it's over, we're like, okay, show me that baby doll you bought with me. And they very quickly snap out of that and they start communicating with you.
Right.
And then telling you jokes and telling you what happened. And, that's the thing I love the most about my job is that I can do a difficult job, but I can also play all day long. And it's just absolutely wonderful.
That's great. Well, that's good. Well, I know, like we said earlier, you have 4 children, so it's
not all children, though.
That's right.
My oldest 2 are actually grown. They're my stepsons, and Craig and Sean.
What are their ages?
And they are 25 and 24.
Wow, they are grown.
Yes, they're grown. and my oldest son is actually married. He has a wife named Andrita, and they've been married almost 2 years now. And so we have a wonderful blended family. Oh my goodness, no. Because I have a 5-year-old and a 2-year-old, so we're not looking for grandkids just yet. But just a great family. They're all great kids.
That's
great
super.
Kids.
That's good. That's great. Well, I don't know how you do it, juggling all that, and it's not like your husband has any free time. He's got a full-time practice.
That's right. No, we don't have much free time, but it's good when you have a family and everyone's there together. Then there's not a whole lot more you can ask.
That's true.
Life.
And you guys have a lot of family right here in Fayetteville too.
Those are the truly important things. So.
Sure. Yeah. Well, that's good. Well, it sounds like y'all have a really nice setup there.
Yeah, just like you.
Yeah,
just
I
like
do.
You. Yeah.
My babies have four legs, and I don't have to save up for college for them. Anyways, well, tell me. Some of the other things. I know something that comes up frequently where we hear about, I know in Europe they basically, I think they banned amalgam, and even though it's been kind of tested as being safe here, I'd like to hear your thoughts about that, the efficacy of silver fillings versus tooth color fillings in children, and if you have an opinion of one way versus the other that the parent should choose. We're going to take a quick break, and when we get back, we'll explore that topic. Okay. You're listening to WFNC News Talk 640, Help You.